Well, up front, your average individual has 4 times as much kidney function as they need. So there's a lot of reserve in the system. But anything that over time decreases this function can eventually result in the need for a kidney transplant. If you drop below that 25% initial mark, then you probably will need a transplant, either dialysis or transplant. Things that can affect the remaining kidney function are factors like high blood pressure, diabetes. Those are the 2 primary causes of diminished kidney function. And those processes cause damage to kidneys over long periods of time, maybe several decades. But if somebody has poorly controlled diabetes or poorly controlled hypertension, the damage can occur relatively rapidly so that they may need a transplant in their 20s or 30s. Other causes are infections of the kidney. Occasionally, if stone disease is left untreated over the long run, it can cause enough diminished kidney function to need a transplant. There's a lot of other potential causes, but the primary one these days is high blood pressure and diabetes. One factor that has really contributed to the increased incidence of kidney failure in America is the rise in obesity. From the year 1991 to 2004, the rate almost doubled, and that coincides with a population that is dealing more and more with that issue, with obesity. So that's a major factor. That contributes to the development of diabetes and high blood pressure. And those are the 2 main causes of renal failure these days. Donors are interviewed by myself and other members of the transplant team before they have made their final decision to donate. They undergo extensive workups, x-rays, blood tests to make sure that their intrinsic health is very good. You have to be in pretty good shape to be a kidney donor. Their heart has to be in good shape to tolerate the anesthetic. Obviously, their kidney function has to be exemplary to donate a kidney. Those individuals have a lot of reserve, so we feel it doesn't put them in increased risk to donate a kidney. And in fact, studies have been done to show that kidney donors actually have a lower rate of kidney failure than their average person on the street. And I think the reason for that is, number one, they have to be in extremely good shape to donate a kidney to begin with. And also, I believe that because they are keenly aware of the importance of kidney function, they make good lifestyle choices. The recipients also undergo a pretty thorough evaluation. We have to be sure that they can tolerate the operation. They have to be in good enough shape to go through an anesthetic and have a major operation. So there's preparation there also. They are usually on dialysis when they come to the transplant center. So that has to be managed either preoperatively or postoperatively. They have to be aware of all the potential complications of surgery. Both the donor and the recipient should be aware of that. Anytime you do a major operation, you have to warn the patient there could be chance for blood loss requiring transfusion. There can be injury to adjacent organs in the area where you're operating, so they should be aware of that. They're informed of those potential complications also. They're told about what to expect as far as how long they're going to be in the operating room, how long they're going to be in the hospital, what the recovery time will be like. So all that is told them before they make their final decision on whether or not to donate a kidney, and for that matter for the recipient if they want to go through the operative procedure. Now there's obviously more incentive for the recipient than the donor, so you have to take all those things into consideration when you're counseling patients preoperatively. Those outcomes are usually measured in 5-year graft survival statistics. About 66% of kidney transplants obtained from cadaveric donors survive 5 years, and about 80% of kidneys obtained from living donors survive 5 years. So those are the general statistics. A lot of patients go for longer than 10 years with a kidney transplant, sometimes 15 or 20 years. So those expectations are that the most kidney transplants are successful. The great majority are. I've been involved in the transplant program here in Austin for over 20 years. I did a little bit of it when I was in my training, but I started participating here, like I said, 20 years ago, and continue to this day. We're a very active program here in Austin. I'd say the most rewarding part actually occurs within the first few days after the transplant. I see the patients, the donors, initially several weeks before the transplant, so I get to know them then. And they're usually pretty nervous, so we really can't enjoy the experience, so to speak, at that point. It's the first day or two afterwards when that patient's been through the hardest part, the donor's been through the hardest part, the surgeon's been out, and they realize that their kidney is actually providing function for the recipient, either a loved one or a friend. That's probably the best part for me. I don't get to see those patients long-term follow-up. They just come back 1 week later and I see them and thank them for what they did. But I'd say it's the look on their face when they know that their kidney's working in another individual. That's the most rewarding part.